My name is Jerry Watson. I'm a patient of Dr. Superior's. On February 5th, 2008, I had my surgery. I weighed 310 pounds. I now weigh 160. I've lost 150 pounds since then. I lost that 150 pounds within the first 11 and a half to 12 months. It was about 15 pounds a month. And I think the reason I lost it so quickly is because I stayed with the program. I didn't deviate. I did exactly what I was supposed to do. I got into this, I jumped in, head first and said, this is what I'm going to do, because I had all the problems that you saw, the five big ones. I had all of them. I was taking the highest dose of glucovance for my diabetes that I could take. They said, that's it, you're not going to take any more. It's insulin starting in about a month. And I said, no, it's not. That's it. I'm not going to go through that. The diabetes was gone 3 days after the surgery. I haven't taken any medication for diabetes since then. Sleep apnea was gone approximately 3 months after the surgery. I was on the CPAP machine. You can tell people have a CPAP machine because they have a red line across the bridge of their nose from using it every night. It's really bad. But I stopped using that and sold it on eBay 4 months afterwards. No more acid reflux. I haven't had acid reflux since the day of the surgery. High blood pressure was gone. What the lady was talking about, aches and pains in back. I had polio as a child, so you can imagine my back looks like a road map of Southern California. But all that pain is gone. My knee problems are gone. My hip problems are gone. I always thought that treadmill was a spectator sport. I actually own one now and use it 45 minutes a day, every day, 7 days a week. If we go on vacation, the hotels or motels we're staying, whatever, they have to have a gym or we can't stay there. Because I have created the habit of doing this on a daily basis. If I don't do it, and I can't believe I'm saying this, you know what I mean? In what I call my past life, I would have never said anything like that. But you can create good habits and bad habits. They're both difficult to start or to stop, okay? So once I created this habit of walking 45 minutes on a treadmill every single day and increasing the slant of it and the speed of it as I go every 15 minutes is something that I have to do. Or I feel like I forgot to do something today that's really, really important. So you'll see what I'm talking about. My main reason for being here today is because in January of 2008, I was sitting where you are right now, thinking, do I really want to do this? Yes, you really want to do this. You cannot believe the difference it's going to make in your life. If this has not been a lifelong problem for you, think about how you felt when you were in junior high, okay? That's how you will feel. You can do so much more with your life. And I don't take any medication at all. I was taking 14 tablets of something every single day, okay? I take nothing now, other than your iron, your supplements you have to take for the rest of your life. So you do that, but that's a very small price to pay. They had a thing up here about hair loss. People worried about that. Two things are going to happen to your hair, whether you have this surgery or not. It's going to turn gray or it's going to turn loose. One of those two, or both. You never know. But who cares? Who cares? If you're going to add 30 years to your life, who cares? Okay? That's the way you look at it. Like he was saying, like Dr. Superior was saying, don't let anything get in your way. This is for you. This is for your life. And don't do this for somebody else. Don't do this for your wife or your family or your husband or anybody else. Do it for yourself. That's the only way it's going to be a success for you 100%. Stay with the program. Do it for yourself, and all will be working out really, really well. And that's pretty much about it.